Well, good morning, everybody. Thank you for joining me. I'm Tony with Mercy Health Lighthouse Family Medicine. Last month we were still McLaren St. Luke's. Now we're Mercy. We're staying Mercy. I promise we're staying Mercy. As we do the third Wednesday of each month, give a talk on a different medical topic. And today we're going to be talking about preventing falls. And it kind of sometimes seems more simple than not. But, some of this stuff might be common sense. Some of this stuff you may not really give much thought to when we're trying to prevent falls. I'll give you an extra. Okay. So we're going to go over some information and then I'll stick around in case you have any personal questions. There's different governing bodies out there that help to care for older adults. The American Geriatric Society, American Academy of Family Physicians. And then you might have heard in the past of USPSTF, which is just fancy for United States Preventive Services Task Force. And that's the group that oversees all screenings for individuals and who should get what shots, what vaccinations. They're the ones that started recommending for women to get mammograms at a certain age, for people to start getting colonoscopies at a certain age. They're also the ones that say, here's what you need to do to make sure that people are trying to prevent falls. So you should be going to your primary care physician every year. If you're 65 and older, you should be getting a Medicare wellness exam each year. They should be doing certain things to make sure that you're doing your best to stay stable and independent. But falls are the leading cause of fatal and non-fatal injuries in people over the age of 65. And almost 3 million people a year end up in the ER related to falls. I know when I worked in the ER in the late 90s, we had a lot of older individuals coming in and they fell and you ask them, how did you fall? And typically it's, I tripped over a rug, I tripped over an extension cord, I tripped over a phone cord or my pet. So we're going to talk a little bit about that. But does anybody know the number one cause of falls, or number one reason, the number one risk for falls? That's what I'm trying to. Does anybody know the number one risk for falls? The answer is a previous fall. So if you've had a fall in the last year, particularly in the last 6 months, there's a greater chance of you having a second fall. Now, a lot of times we escape injury and are able to just get up and, nothing happens. But a lot of times, 1 in 3 of people's falls are going to result in needing some type of medical treatment. It could be a fracture. It could be that we need stitched up. It could be we need to rule out anything related to a traumatic brain injury, like a concussion if we hit our heads and things like that. But 87% of fractures in older adults are due to falls, and 95% of hip fractures are the result of falls. And a lot of us probably know that as we get older, if we have a hip fracture, particularly if we're in our 80s and 90s, what that typically leads to. It typically leads to further complications because you're not able to move. So you end up with things like pneumonia, and pneumonia, if not treated aggressively, a lot of older individuals can't recover from that, and it ends up in death. So, and if I'm one of those people that reads the daily log in the paper and reads the coroner rulings, and so you see a lot of older individuals, if they've had a coroner taking a look at their case, it's related to a hip fracture from a fall. It could be either at home or in a nursing home or, wherever they're currently residing. But as it says here, 66% of people who have fallen will have another fall in the last 6 months. So what leads to falls? There's something called, there's different types of risk factors. There's modifiable risk factors and non-modifiable risk factors. What does that mean? Modifiable risk factors are those things that we can change. Non-modifiable risk factors are the things we can't change. What can't we change? We can't change our age. We can't change some of the medical conditions we have, like arthritis. If we have things like dementia, we can't necessarily change our sex. If you've had a stroke or a mini stroke, you can't change your race. And things like if you've been discharged from the hospital, you should be getting, if you're discharged from the hospital, you should be getting what they call a TCM call, and that's a transition to care management. So somebody should be calling you probably from your doctor's office to see how you're doing since you've been discharged from home or discharged from the hospital to home. Make sure that you have the medications you need, making sure that if there was home care set up, that those people have been in contact with you, making sure that if you were set up for physical therapy, that all that's in place to start getting things in order. Because the last thing you need to be doing is going home from the hospital and then waiting for things to happen and not getting any phone calls or any intervention that's necessary, and making sure that you have the medication. What are some of the what are some of the modifiable things that we can change? Alcohol use, we can certainly reduce things like that, because alcohol use can lead to things like dehydration. Dehydration is one of those modifiable things that we can change. And then dizziness or vertigo is certainly something we can change as well. So if you're having those types of things like dizziness and that, we need to determine, is this an isolated incident or is this a problem? Is this something that is happening more frequently? And so, and leg cramping is another one. Sometimes people get up in the middle of the night and because they have a cramp and they start walking around and end up having a fall. Who does that happen to? This guy. So fortunately, mine didn't result in an injury too much, but you know, when you get woke up in the middle of the night at 3 o'clock in the morning because you have really bad leg cramps and you're trying to walk it off and you're still in the sleepy mode, it certainly can result in some things. So we're going to talk about things like vision impairment in that as well. This focus for me is really on preventing falls. So knowing your risk factors. When I give this talk at some of the senior living places, a lot of these people are in apartments that are already kind of almost like child-proof, but adult-proof. So they want to make sure that you don't have cords, you don't have area rugs and things like that. But a lot of us live in our own homes here, come to the facility here in Bowling Green. So we need to think about, do we have area rugs out? We have either hardwood floors or we have carpet, and like my mother, who wanted to have a runner here and a runner there and an area rug here because she wanted to keep her carpet underneath really nice. Or, you know, she had her telephone over there when the outlets over here are the plug-ins, so it ran across, you know, this area. And she's like, well, I'll just cover it with another area rug. Or, you know, having pets. Sometimes we have our pets down at our feet and we kind of doze off and take a nap, and then the doorbell rings or the phone rings, and it's human nature to want to try and get that thing in a hurry, answer that door or answer that phone. Just a bit of caution. If it's that important, that person will call back or leave a voicemail or something like that. The other thing you want to do, a lot of falls happen, not just in the living area, but also in the bathroom. So you want to make sure that you have grab bars. Unfortunately, these are things that are not typically covered by Medicare. However, certain diagnoses will get some of these things covered. So take a look at getting grab bars, getting toilet seat risers, and making sure that you have decent lighting in the house. Making sure, I mean, this room is very well lit. Some people like it a little bit darker, but if you're going to be in a room for a period of time, just making sure that it's well lit so that you're more cognizant of what your surroundings are. The other big thing is knowing your medications and knowing the potential side effects for medication. And if you're going to be starting a new medication, determining if there's a drug-drug interaction with something else that you're currently taking. How do you know that? Ask your pharmacist. Every time that you go to the pharmacy to pick up your medication, either a new medication or a refill, they're going to say, do you have any questions of the pharmacist? And a lot of times we say no and check the box no on that little screen because we want to get the heck out of there. But take a moment to think about, what is this medication being used for? And do I truly, a lot of times when the pharmacist is filling that medication, particularly a new one, it'll spit out to them some warnings, some little red flags if there's a drug-drug interaction. But some of us might be getting our medication from one pharmacy and then the second pharmacy, and then even getting some mail, prescriptions filled by mail. So there isn't necessarily that correspondence between those 2 or 3 places. But we know that your primary care physician should have access to all that information. That's why I encourage you to go to a Medicare annual wellness visit. And a medication review is part of that. But there are certain medications that are going to cause more problems related to falls. First one's diuretics. So the diuretics could either be something like a heart-related medication, or it could be something that, because we have a potential for fluid overload, they're asking you to take other things. And what happens? You go to the bathroom more frequently. And sometimes when you gotta go, you gotta go. And you're not paying attention to that area rug or that cord or the pet. So you can have laxatives is another one for people that have issues of constipation or need a little bit more help trying to keep regularity with their bowels. Laxatives can sometimes sneak up on you. So opioids is the third one. The opioids are things that we use to control pain. We've had a talk before where pain meds cause constipation, but the other thing is the effect that it has on our brain. So they make us a little bit more sluggish. Same thing with benzodiazepines, which is just a fancy term for medications that help to treat anxiety. And then things like anticonvulsants, antidepressants, anti-Parkinson's medications. And we say as a typical consumer, well, how do we know? I mean, if you look at any commercial on TV prescribing or promoting a medication, they'll say side effects are, but they're speaking like a well-trained auctioneer. I mean, you just really can't understand them. Or if you're reading that in the paper or magazine, those side effects, you need 2 magnifying glasses to be able to look at that stuff, because you don't know. It's their responsibility to put it there, but there's no regulation of saying how slow they need to tell you what side effects are, or how big the wording needs to be for you to be able to see that as a consumer. So again, medications are an extremely big part of things. The other big thing in terms of preventing falls is promoting bone health. And we can do that one of 2 ways. The first way is through regular exercise. You have a great location here. Offer things like just regular exercise, Tai Chi, yoga, everything to help maintain balance and, some resistance training. And you may say, I've tried that stuff before. I don't like it. You know what? Try it again for the first time. Go with a friend. Did you try and do it by yourself? I mean, keeping an open mind, maybe doing it a couple of 3 times, and then it's just like anything else. You give it a second fair chance and you might find a different enjoyment in that. The other thing is having routine osteoporosis screening. So there is regular bone health, there's osteoporosis, and then there's something in between called osteopenia. Osteopenia is where the beginnings of osteoporosis How is that typically detected? By DEXA scan. And again, the USPSTF talks about when we should have these types of screenings. And then your primary care physician, when you're having a Medicare wellness exam, knows the parameters. It's even in there, built into their computer of when you should have these types of things done. And as long as it's medically necessary, then Medicare will help to pay for those things. Supplements. People ask, well, if I have regular bone health, how can I keep it that way? Or if I have osteopenia, how can I slow the process of going to osteoporosis? And the big thing is vitamin D. And you should, some people take multivitamins. You should need to look at the back of that, because you should be taking a recommended dose of at least 800 IU, which is 800 international units. I mentioned a couple of governing bodies early. One of them recommends 800 and another one recommends up to 1,000. Is that extra 200 going to hurt you? Absolutely not. Most of the time, excessive vitamins and supplements in our body will just get excreted from the body in the form of urine. So that is something that, and then calcium is another thing that individuals should be taking. Again, it depends on what your doctor recommends so that they can make sure that you're getting the proper amount, but that you're also that is working in conjunction with the vitamin D. A lot of times they're sold in dual form, so you can get both at once. But there are many different vitamins out there, different companies. So you just need to determine that you need to be a smart shopper when it comes to those things. A lot of times, certain stores in the area will do buy one, get one free or something like that. So you just really got to find the deals, because now it seems like everybody wants to get on board with vitamins and supplements and things like that. And the cost has been driven up, unfortunately. So you need to just be a smart shopper when it comes to that. Vision, I can't express enough in terms of vision, getting an annual eye exam. And once you get an eye exam, make sure that, I don't know if you're going to an optometrist or an ophthalmologist, if you have a history of diabetes, they should be doing, a certain type of diabetic eye exam. Please make sure that you let whoever is doing that exam know who your primary care physician is, because a copy of that vision exam should be sent to them. That way it goes in your electronic health record. Your primary care physician has a more clear idea of how to treat you as a whole person, and Medicare will audit their records to make sure that those types of reports are in there. And the doctor will get dinged if you've had an eye exam and they haven't followed up to get those reports. The second thing is, if you wear glasses, please don't be like my 26-year-old son, who I don't know how he can look through these things, but he never cleans his glasses. And, it's like driving with a bunch of bird poop on it and then hitting the windshield wiper, and now things are worse. And I just don't understand. So having clean glasses will make a significant difference in being more aware of your surroundings and not identifying hazards and things like that. And I already mentioned that about appropriate lighting at home. Assisted devices. I don't see anybody coming in here today with a walker, but making sure that, if it's a walker or a cane that's in good condition, I encourage people who are using cane to do more than just a single bar cane, but using a quad cane, making sure that regardless if it's metal or aluminum or wood, that you have a really good grip on the bottom of that thing. So occasionally looking at the bottom, just like the soles of our shoes get worn, the bottom of those canes get worn, because if you have a metal cane and now the bottom of it is worn and you're on a wet floor, that cane's going to do you no good. So making sure things like that are in good use. talked about things in the bathroom, but now there's a lot of different, devices out there. Some of these smartwatches that people wear can identify if someone's had a fall. Having cameras in the home. In addition to the ring outside, there's something for the inside. If you are a person that needs the medical alert button, making sure that you have that at all times. There's even technology has gotten so incredibly advanced that there's now even floor sensors that if you were to fall on the floor, that it's going to alert somebody that happened. So a lot of advances in terms of trying to keep individuals safe, but again, some of this stuff costs money. All of it costs money, and a lot of times it's not reimbursed by Medicare. So the biggest thing is you want to make sure that you assess your fall for risk, talking to your doctor, and on the last page, there's a screen there to determine whether or not you are at risk for falls. So the biggest thing is making sure you answer that honestly. And if there's some concerns, address them with your doctor. When you go for that Medicare annual wellness exam, I'm sure some of you have done the tug. It's called the time up and go. So it's sitting you in a chair. It could be with or without arms, and they tell you when they say go to get up, you walk probably toward the end over there, turn around, come back, sit down. They're not necessarily looking for how fast you're walking, getting up and walking. They're seeing how safe you are in getting up and sitting down and looking at your gait. So how you walk, if there's any unsteadiness there that needs to be addressed. My final two messages are for women. Make sure that you are wearing good shoes, not wearing 4-inch heels anymore. That you're wearing a lower heel or flats, something that's comfortable, something that's going to keep you safe. And then, starting to assess whether there's a need for physical therapy. Maybe you are just having some troubles right now and a little unsteady. It's amazing what a good physical therapy evaluation and a little bit of intervention can do to help keep people stable. So again, my two take-home messages are: number one risk for falls is a previous fall, and my second take-home message is make sure that you're getting screened when you go to the doctor on an annual basis. And that's about it. Any questions?